Hello, this is Dr. Philip May. I'm the Director of Medical Education and Training for the International Foundation for Chronic Disabilities, and I'm going to be speaking to you today about the prevention of fractures in adults with medically complex disabilities. Before we get into the discussion of fractures, I'm going to give you a little background on chronic brain disorders. The IFCD mission is to try to improve the quality of care for patients with chronic brain disorders. And chronic brain disorders fall into three major categories. There's the childhood onset, for example, developmental disabilities, intellectual disabilities, cerebral palsy, epilepsy, autism. There's the younger adult onset type, traumatic brain injury, multiple sclerosis, various types of head trauma which can occur in the young adult. And three is the aging-related onset of chronic brain disorder, for example, Alzheimer's and strokes. There are hundreds of different types of chronic brain disorders, but they generally fall into these three categories. If a person has a chronic brain disorder, there are four major clinical complications that can result from the chronic brain disorder, regardless of the cause and the age of onset. And these four categories of symptoms fall into these four areas of cognitive, motor, seizures, and behavior. So that a person with Alzheimer's disease or a person with Down syndrome can have cognitive problems, they can have motor problems, they can have seizure problems, and they have behavior problems. Now, fractures are a consequence, a health consequence of all these complications of the chronic brain disorder. So whether the complication is cognitive, motor, seizure, or behavior, fractures can occur in all four of these categories of complications for different reasons. Now, getting into specifically the problem of the fracture, there are three strategies designed to reduce the risk for fracture. One is to improve environmental safety, the second is to prevent falls, and the third is to improve bone strength. And we're going to talk about each one of these categories over the next few slides. First, environmental safety. Things like optimal lighting, ensure non-slip walking surfaces, strategic placement of furniture to prevent tripping, and a safe patient mix if in a group setting. In other words, mixing aggressive individuals with fragile individuals can have a bad outcome. So first of all, think about the environment in preventing fractures. The next thing to think about in preventing fractures is preventing falls, which can lead to a fracture. And there are a number of different issues to consider in preventing falls. First, ask yourself, could the motor function be improved? Sometimes people are on drugs which are having adverse effects on motor function, like neuroleptics, which can cause different types of dyskinesia. Also, the person may benefit from regular physical exercise to improve motor function. Physical therapy may help. Secondly, consider the behavior. A person with severe impulsive behavior is at greater risk for falling, and their drugs can help with that situation. But on the other hand, there are some drugs that have behavioral consequences. There's some anti-epileptic medication and psychotropic drugs that can worsen behavior. So consider the drugs. If possible, consider a behavior modification program developed by a psychologist to see if that can help with the maladaptive behaviors. It's a bad combination to have ataxia and impulsivity. A person has the urge to do something, but yet they're not coordinated. They can suddenly jump up and run after somebody and then trip and fall. So anything that you can do to improve motor function and improve behavior, optimize those two issues, would be very important. Of course, better seizure control, using medications is helpful, and sometimes that means adding, sometimes it means withdrawing certain medication. There's certain drug interactions, and seizures can be a side effect of psychotropic medication sometimes. So think about the seizures, because certainly a seizure leads to a fall, and that can lead to a fracture. Having eyeglasses for better vision, better staff supervision, again, optimizing the environment. And lastly, vitamin D is a hot topic now, and the Institute of Medicine and the U.S. Preventative Services Task Force and the Endocrine Society and many individuals all agree that vitamin D optimization can be very helpful in preventing falls. And of course, we're going to be talking about vitamin D when we talk about improving bone strength, which is on the next slide, I hope. Okay, yes, improving bone strength is the third strategy to prevent fractures. If you can make the bone stronger, even if the environment is poor and there's a fall that occurs, if you have stronger bones, it's less likely that you're going to have a fracture. So how does one improve the bone strength? Well, first, to increase weight-bearing physical activity. Secondly is eliminating bone-toxic drugs. We've touched on that already. There are many drugs that are toxic to bones for different reasons. The third is optimizing vitamin D and calcium. Many suggest a blood level check. An optimal level appears to be 40 to 50 nanograms per ml, which is a bit higher than what's recommended for public health concerns. But in this population, it may be that they need a better level of vitamin D to get optimal effects. And lastly, bone pharmaceuticals, such as bisphosphonates, denosumab, and teriparatide or Forteo are all used and are very effective. There's some that are now being developed. They'll be coming out soon. These are antibodies against various chemicals that the bone cells make. The osteoblasts and osteoclasts make chemicals that we'll call the metabolic bone markers, which will be the topic of future discussions. So these are the ways that bone strength can be improved. Now, whatever you choose to do, whether it's environmental change, whether it's reducing the risk for falling, whether it's making the bone stronger, and you have a program, you use all of these strategies to try to reduce fractures, you want to monitor the efficacy of treatment. And medically, a bone mineral density DEXA test is important to show whether the bones are getting stronger. And also, metabolic bone turnover should be evaluated, and to show that there's not a lot of bone turnover going on. And this can be determined by measuring serum levels of P1NP and CTX. We're not going to get into discussion of the metabolic bone markers in this talk, but in the future we'll have some more information on this. So finally, we need to distinguish between reducing the risk for fracture, and that's what physicians try to do with their treatments, and reducing the actual incidence of fracture in a population of patients. So it's important for physicians to collaborate with human services administrations in establishing quality assurance and quality improvement programs designed to demonstrate efficacy of fracture risk reduction, which occurs from clinical practice, on reduction of the actual incidence of fractures in the entire patient population. So we all have to work together to reduce fractures and improve the quality of life of our patients. That's all I have to say for today. Thank you very much for listening. You can learn more about the International Foundation for Chronic Disabilities at www.chronicdisabilities.org. Thanks again. Bye-bye.